CDC guidelines and practice physical distancing. And physical distancing means stay at home, wash your hands, do all those things that enhance personal hygiene, and monitor your own health for symptoms such as possible to minimize the transmission and protect the family in our community. And stay home. If you're experiencing symptoms of COVID-19 like cough, fever, or finding it difficult to breathe, call ahead to All True COVID hotline at 701-780-6358. 701-780-6358. I'm so proud of the work our public health professionals who have been planning and preparing to mitigate the health impact of COVID-19 in our community. We must do our part and help them staying home and stopping the spread. This will be a marathon. President Trump extended physical distancing restrictions to April 30th. Since our region is a little behind the rest of the country, we need to stay the course and prepare for another 6 weeks of this way of life. As Governor Burgum has said, now is the time to be North Dakota smart. Keeping our physical distance is the key to mitigating this virus, and it's important we all continue doing so. However, physical distancing does not mean social isolation. We need to continue to be socially connected, physically healthy, and caring for our mental well-being. Call friends and family, video chat, look out for your neighbors, go for a walk or a run, exercise at home, read a book, play games. We're following the governor and taking a whole of government, whole of community approach. We are in frequent communication with our community partners. This morning I spoke with UND President Wynn and incoming President Armacost on their efforts and perspectives and how we plan to have a UND representative participate in one of the press conferences in the future. We also have a city council meeting this evening where we will be providing administrative updates on the continuity of operations, flood action planning, and the economic and social sustainability planning. It'll be broadcast on GFTV2 and Facebook Live. We're in this together, and we will get through this together. Be vigilant, be cautious, be North Dakota smart, stay home, slow the spread. Thank you.
Thank you, Mayor. Next, we will head to Mrs. Deb Swanson from Grand Forks Public Health.
Good afternoon. I too would like to extend my appreciation to everyone who's watching this news conference and looking for more information. Now that we have 2 cases in Grand Forks County, it becomes even more important for us to be vigilant to all those public health messages that you've been seeing and hearing about. What happens next, I think, is the question for most people at this point in time. Please know that the Grand Forks Public Health Department has a team of professionals that will be reaching out to contacts of individuals who have tested positive and have reported their county of residence as Grand Forks. They will be talking to those individuals to ascertain what their risk is and to recommend testing and ascertain if they have any symptoms. This is an important, very important part of our next steps in this process to identify people who need treatment, testing, and care. We ask that you continue to be vigilant. We know that people have made tremendous sacrifices the last couple of weeks. Our lives have been pretty much upended the last few days. We knew that this was coming. We've prepared as much as we possibly can. We want people to be prepared, but not to panic. I will be doing a presentation at tonight's City Council meeting that will have quite a bit more information about number of cases across North Dakota, what we're doing as a public health department in terms of all the logistics that are going into this response effort. And I would encourage residents of Grand Forks and the surrounding area to tune into the City Council meeting tonight on our public access channel for more information. We'll be sharing hotline numbers, places where you can get your questions answered, and a whole lot more information. Please know that we are working very closely with our community partners to make sure that all of our residents can be as safe and healthy as possible. And now I'd like to turn it over to our community partner at All True Health System.
Go ahead, Dr. Deere.
Thank you, Debbie. Thank you for the opportunity to be part in this panel. As you have heard, the first 2 confirmed cases in Grand Forks County were reported. In contrast to other large cities in North Dakota, our impact is still low. That said, we should continue to be diligent in practicing social distancing, hand washing, avoid touching our face, and monitoring respiratory illnesses. We continue to prepare as a health system for more cases in our region, ensure we can continue to screen, test, and manage care for these patients. We have plans on both the inpatient and outpatient side already in place. We have a sick clinic that is available and operational 7 days a week. We continue to do screening through the COVID hotline. A which Dr. Brown remembered the number of very well. Thank you, Dr. Brown. This has allowed the other clinics in our health system to continue operationally, mainly as normal, in a safe environment for our general patient population. We have also increased the utilization of video visits and did a lot of preparation last week to operationalize this so we can reach patients in their home, and even reaching out further, potentially reaching nursing home patients in their home as well. We continue to test without any changes from the guidelines from our last report on Friday. Currently, we have 469 tests available for community use. We're focusing on proper use of personal protective equipment and realize that this is a vital resource for our staff and patients. Strategies are in place for safe use in the most appropriate care environments, with ongoing work with our partners for ongoing supply replenishment. New technology is also starting up with the fight against COVID. As many of you have seen over the weekend and over the last several days, teams of experts are working at the national level in large corporations, large health systems, and large research centers to help with testing supplies, supplying personal protective equipment, and treatment options for COVID. Again, I'd like to thank you for having me on this forum today on behalf of All True, and look forward to the questions.
Thank you, Dr. Deere. At this point, I will open it up to questions from the media, and that happened pretty quick. Mr. Joe Bowen, please ask your question.
Hi, everybody hear me okay?
Yes.
So we had a whole bunch of questions about the 2 positive cases today. Grand Forks County is pretty big. Can any of you say whether or not either, neither, or both of those people who tested positive live in Grand Forks proper, like the city itself?
I can answer that question. We do not know the exact address or location. I do not know the exact address or location of these residents. We simply get the information reported by county. Once our case investigation starts, that is the more confidential aspect of our follow-up. So at this time, I can't provide an address or a location. We just get it by county, the information by county. We also do not know the source of their testing at this point either. Keep in mind that we have a really good, robust way of testing individuals who need it. And that includes a lot of healthcare providers. All True Health System has done a wonderful job of responding to testing, but there are other providers both in Grand Forks County and in our surrounding region.
Thank you, Deb. Dr. Deere, would you like to add anything to that, or?
Yeah, we know no specifics on the cases, so I would listen to Deb on that topic.
All right, thank you, Doctor. Hand up from KNOX. Go ahead, KNOX.
Sure. Let me see if I can get myself unmuted here. Okay, there we go. This could be for Deb. This could be for Mayor Brown. I'll let either of you take it on. I'm sure people are going to want to know how we make sure that people who test positive stay in the isolation they're supposed to stay in for the period of time they're supposed to stay in it. And that's probably a good question that we should have asked no matter where the cases were. Now that it's closer to home, I'm sure more people are going to want to know. So how does that process take place where we know that the 2 people who have tested positive sort of isolate and do what they're supposed to do?
I'm looking at Mayor Brown first.
I would pass that to Deb.
Okay.
What do we have in place to make sure people follow what they're supposed to do?
Deb?
I'll be happy to answer that question to the best of my ability. Because we've been through this before with other diseases. We had a TB outbreak in our community a number of years ago, and we did have to work very hard to ensure that people had a safe place to either quarantine because they were exposed to a case, or isolate because they actually had tested positive and may have had the disease. In this case, it becomes even more important that people isolate themselves in a safe place where they aren't exposing others, because of the fact that this is a novel virus and our population doesn't have any immunity to it, and we don't have a vaccine for it. So we'll be sure to be checking in with people to ensure that they're maintaining the recommended level of isolation. If they are ill, they'll be hospitalized, and that will be ensured that they cannot pass the disease on to others who are also in the hospital. We do know that some people have mild illness, and it becomes even more important for those people to maintain that isolation because they still can infect others. We are asking people to be on their honor, but certainly if we find out that there are individuals that are not abiding by that, we do have some tools that are available to us to require containment.
Thank you, Deb. Question from Mr. Joe Bowen. Sorry, Joe, I think we bumped at the same time. Go ahead, Joe.
All right, hi, can you hear me?
Yes, we got you.
Sorry, so it sounds like it's honor system up to a point, and then you said you had some tools to make sure people are doing what they're supposed to do. What are those tools?
Quarantine and isolation is not only for the large public in an incident like this, but it can also be towards an individual. So it can be a local health officer's order or a state health officer's order.
Okay, KNOX, you have a follow-up question?
Actually, a couple of questions for Dr. Deere, not necessarily related to the people that have tested positive, but it may relate to a certain extent. In Dr. Deere, we're hearing a lot about various things that are coming out from the FDA that may take some time to trickle down to the local level, but the FDA has approved chloroquine and hydroxychloroquine for use in certain cases with people who have COVID-19. And we're also hearing from the FDA that they've approved a 15-minute coronavirus test. Can you address either of those products and what you know as far as how they relate to a local level? Are doctors at all true willing to prescribe those medications now that the FDA has approved them? And do you know when we might be able to get our hands on 15-minute tests?
Dr. Deere.
Yeah, I don't have the specifics on when we'll be able to get the 15-minute test, but I do know that our team is working on vetting those options. It's e-swab and it does take about 15 to 45 minutes to result, so that's something that we're looking into from our testing capabilities. The other question on hydroxychloroquine and chloroquine, majority of health systems do have them in standard protocols for when you can use them. And we're working with all of our partners, including Mayo, to get our inpatient protocols in line with what they're using.
Thank you, Dr. Deere. Looking to the media for any follow-up questions there, Mr. Joe Bowen.
The two people who have tested positive, were either of those cases travel related, and when were they tested?
I'm not sure where to direct this one. Deb Swanson?
Because the contact investigation is just beginning, they are considered a case under investigation. Once additional information is determined, then they would be either classified as travel or community spread or continue as a case under investigation, a person under investigation.
Thank you, Deb. We do have a quick question. This is a question, I believe, for either Mr. Todd Phelan or Mayor Brown. This is from a Facebook question. House parties. We are a college town. Is there a way to mitigate house parties and gatherings like that?
I would think that gatherings over 10 people are prohibited. So we would expect somebody, if they see something like that, to report us so that we can act on it. And I can't believe people haven't gotten the message. Stay at home, wash your hands. If you have to leave your home, when you come back, wash your hands for 20 seconds with hot soapy water, sterilize surfaces frequently, and be aware that this is a real situation and the life you save might be yours.
Thank you, Mayor Brown. Question from KNOX.
For Mayor Brown or Deb Swanson, either would be probably accurate for this one. Over the weekend, Governor Burgum issued some new guidance for people that are travelers, anybody coming home from international travel, along with 24 states that are considered quote-unquote hotspots, in other words, widespread community infection. And we don't have any neighboring states that are in that right now, but it's half the country as far as states are concerned where people could be coming back from. We were told the Highway Patrol was going to enforce this 14-day mandatory quarantine if you're coming back from those places. Will our local law enforcement be a part of that in some way, or Are we just going to see more highway patrol vehicles in town? Because there aren't a lot of patrolmen as it is.
I don't know how the highway patrol could manage that function. I don't know if that's in their purview, but I do expect people who are returning to monitor themselves and quarantine themselves for 14 days. And that means stay at home, don't go out, don't expose other people to you until after we know you're safe. So I think we would expect you're on the honor system, but I know someone will report you if you don't.
Okay, anyone else like to take a shot at answering that one? No, Mr. Joe Bowen, you have your hand up.
Yeah, hey, so it sounds like a lot, we basically don't know a whole lot about either of those two positive tests, and it sounds like a lot of that is hinging on like a study, it sounds like, of some kind. When is that study supposed to be done?
Deb Swanson?
Sure, I'll be happy to address how a contact tracing or contact investigation happens. When we get results of a positive test from the state health department, it goes to our local epidemiologist who's employed by the North Dakota Department of Health. And because he won't have the capacity to do all the contact tracing that's going to be necessary, our staff have been trained to do that. So they will be assisting finding out from that individual who they came in contact with the last 14 days. So there again, the mayor's message is extremely important to stay home, because then you won't have to be thinking about who you've come in contact with in the last 14 days. We've all been asked to stay home. The average number of contacts that we're finding in current contact investigation is about 5 people, but the most is about 36. So that's people who are going to work, who maybe could be working from home. It's people who are maybe in small groups, or they have large families. So the more people that you come in contact, the more complicated that contact tracing can be. So once again, it becomes really important to stay home, limit your contact with as few people as possible, limit it to a small number, and that will make the job a lot easier. Sometimes it's very easy to do contact tracing because maybe there's only a couple family members, and then that can be completed in a fairly short period of time, maybe 24 hours. But if there are many more contacts, it will take longer to do that. How you will know it's complete is when a person is classified then as either travel related or community spread. What we do know is we're seeing more community spread, which means people have no idea how they tested positive. They don't know that they were in close contact with someone else who tested positive. What will happen as a result of this process is that more people will get tested, and we will likely see more people who are testing positive.
Thank you, Deb. I see a hand up here from KNOX.
Yeah, so I need to go back to the travel question, and apologies for belaboring the point, but I think we need to know a little bit more about what we're supposed to do. So a couple of these states that are on the list where we're supposed to mandatorily quarantine for 14 days when we come back from them are popular places. Arizona being one of them because snowbirds are there. Colorado another. People like to go to Denver, et cetera, et cetera. There's 24 states here. So the governor's office said the highway patrol would enforce it. If I'm one of these people coming home and the highway patrol can't enforce it, Deb, Mayor Brown, what am I supposed to do? Do I call somebody to tell them I just came home from Arizona? Is that completely on the honor system as well, that I just know I came back, so I stay home for a couple of weeks? What's the process for somebody coming back from one of these states?
Deb Swanson.
It is the honor system, and that's why we're asking the public for their help. The public has a lot of control over how the virus affects people in our community. However, I will say this, the order from the state health officer, also it is a state health officer order, just to clear that up, it's not a governor's order. And what it does is it ensures that the public is in as safe a place as possible to prevent the spread. There is a provision in there that if people feel they do need to leave their home, they can contact the local health department and we can give them advice. For example, if they need to go to a doctor's appointment, we'll advise them to call first so that they know where to present. If they need help getting food or some other basic service, we can assist them to make sure that they know what those resources are in our community. As far as enforcement, if it's reported that people are not maintaining that quarantine, yes, there are some provisions for law enforcement. I think Mayor Brown's right. It's probably not realistic to expect that the Highway Patrol, but that is a law enforcement agency that is under the purview of the governor. So I'm sure that's why he mentioned the law, that particular branch of law enforcement.
Thank you, Deb. I do have a question. This is for Mr. Phelan. Came over Facebook. At what threshold within the city do we expect to see changes to the city bus system? I'm looking at Mr. Phelan on this one. Go ahead, Todd.
Well, you know, public transportation, even from Governor Burgum, has been noted as a essential service, and for essential things that people have to do that do not have another mode of transportation, whether that's to a medical appointment, to a pharmacy, to a specific store, to so that they can function on a day-to-day basis. So we anticipate, much like law enforcement, public health, waterworks, that public transportation will continue as an essential service. And I think that's been the message of Governor Burgum throughout the state and throughout local communities like Grand Forks that have public transportation systems.